The Community Engagement Toolkit shares 10 principles to guide researchers in planning for and working with community organisations for health and care research. It also provides a great resource for VCSE organisations to inform their conversations with researchers. But how do we put those principles into practice? Our first principle is do the groundwork and prepare.
When researchers have done their research, so they've looked up different ways to communicate with people, especially people with a learning disability and or autistic people, it just shows that the researchers, really care and really want to get it right. We have very specific terminology that we use when working with older adults, so it's always lovely when a researcher gets in touch with a staff member beforehand just to know how to best approach topics.
Our next principle is find trusted community workers and leaders who can help broker introductions with wider communities.
When we engage with researchers, if they are looking to speak to a very specific demographic, we do have networks within the Elders Council. If they are looking to do more activity-based research projects, we would direct them to search. So we've got this extensive network both within the organisation and outside of it. And I think we're really good as an organisation to know that if a project doesn't quite fit, then we'll make sure we always signpost the researchers on.
We get approached about community-based research, and we've supported Hindsight Mind, wanted to know better about South Asians' perceptions of mental health, and we helped facilitate for them to get connected to network members and to pay the network members to do their own research with their own community, which led to high engagement, trust and building up understanding around mental health, which is often a taboo issue. And then as a follow-up to the research, health and wellbeing sessions have been developed with those groups about the topics they raised.
Principle number 3 is respect the vast knowledge and experience of communities.
One of the biggest hurdles are issues around payment and reward for people's involvement. There's a really clear expectation from funders, particularly from the National Institute for Health and Care Research, that service users, experts by experience, community organisations are remunerated for their involvement in research. The onus is on the researchers.
We always take research projects that have financial remuneration to the research and impact group first. So we speak through the proposal and we say to the group, do you want to be the VCSE partner for this? Is it something you're interested in? And that's really important to us because we're member-led. We want to make sure that it's not just what the staff are interested in, it has to come from the members themselves.
If you go to do this, do it willingly and that you're learning from the group as much as the group's learning from you. It's really important. That's seen as a learning opportunity and you're not there just to give information to people.
Our next principle is be honest about the scope and resources and don't overpromise. Agree ways of working and core values.
I think there needs to be tempered with realism and not over-promising. And that works both ways. Sometimes a piece of research will have a beginning, a middle and an end, and then it stops. You need to be explicit and upfront about that. And equally, voluntary community centre organisations usually getting involved in research is not core business, and so we need to be realistic ourselves about how much time we can dedicate.
It's just being honest about the scope of a project. If you know that you're not going to get results for a year or 2 years, that's absolutely fine. We would rather just know.
Our 5th principle is be flexible about where and when you arrange meetings.
Think really carefully about where you're going to do the research. Sometimes people want to come into university buildings. They want that kudos of being in the big kind of clinical space. But sometimes people want it somewhere that is really familiar to them. So think about accessibility, think about familiarity, think about cost. The biggest piece of advice is to talk to people co-producing the research with you, the community organisation, about where they would suggest research takes place.
Our next principle is be generous. Build in impact and consider ways to give back beyond your specific project needs.
We had our Hindu temple elders group who wanted to know more about dementia because they didn't understand the symptoms. So our researcher developed a health and wellbeing information session for the group and made it culturally appropriate. She went to the temple and delivered it. She accommodated people who may have little English and worked with the group about what they wanted to know more about.
Give us time by writing us an article, for example, speaking on a radio show, just engaging with our members, just to know that their voices are heard and they're valued.
I think of some exemplary instances where researchers have embedded themselves thoroughly with us. They've become members, they've done courses, they've done groups off their own bat because they're interested. It's actually how we secured a couple of our trustees.
Our 7th principle is to invest time. Genuine relationships take commitment and time to develop trust.
The best research projects are the ones that take the time to recognise the value in real human connections. From a VCSE side of things, we're working really hard to make sure that we maintain those strong lines of communication.
Our next principle is to be creative and innovative using different ways of working.
There are lots of really good, innovative ways of doing research which can be co-produced with community organisations and people with lived experience. It might be art, drama, poetry, music, producing things in different languages, using British Sign Language to disseminate information.
Our 9th principle is to listen attentively and engage fully with the needs and priorities the community share.
Our advice is always to make sure that wherever possible, researchers approach individual service users, people with lived experience and community organisations upstream, and they ask people for their help to identify what the research question is and then make all the important decisions in partnership with those organisations and those communities.
Our 10th and final principle is to be responsive. Communicate regularly, feedback any outcomes, and to say thank you.
It would be really good to see researchers sort of coming back a bit more and feeding back on this is now a report that's going to be shared with all these people and this is the difference it's going to make.
It's when researchers make that extra special effort to come back to us and actually let us know, even if the results didn't go the way the project kind of intended, we'd rather know. And it means our members are more willing to get involved. And it just builds on the relationship between community partners and researchers.